Okay, go.
All right. Hi, good morning. My name is Laura Cox. I'm Shield Healthcare's Ostomy Lifestyle Specialist, and today I'd like to welcome you to our webinar event. Our program today is being hosted by Shield Healthcare and sponsored by the Wound Care Education Institute. So WCEI was started by two nurses, Donna Sardina and Nancy Morgan. They have one goal in mind: to improve the management of wounds and ostomy for patients across the U.S. WCEI currently supports over 20,000 alumni through their certification courses in wound care, diabetic wound care, and ostomy. In addition, WCEI hosts the annual Wild on Wounds National Conference held in Las Vegas. During the conference week, there is an opportunity for those wishing to become certified to attend a certification course and receive the WOW, the Wild on Wounds Conference, as a bonus. Today, Shield is offering a special discount code to receive $50 off WOW registration. Simply use the code SHIELD17. So before we begin the webinar, I'd like to run through a few housekeeping items. First, for those clinicians wishing to receive education credit, you will receive an email from WCEI within 24 hours after the webinar with instructions on how to obtain your certificate. Please be sure to check your spam folder for an email from WCEI. Second, if you have not yet downloaded the handout for today's event from your reminder email, you may do so now by clicking on the link in your sidebar. Third, for those that are participating in a group setting, please click on the document called Group Packet. You must submit the forms to receive educational credit. Again, this is only for group participants. And fourth, as a reminder, to receive educational credit for this webinar, you must be logged in to view the actual presentation. No credits can be awarded for those who do audio only. And now, please welcome Joy Hooper, RN, BSN, CWOCN, OMS, and WCC of the Wound Care Education Institute. I'll turn it over to you now, Joy.
Thank you, Laura. And welcome, everybody. Today we are going to talk about many things concerning ostomies. Because I tell you, when somebody has a problem with their pouch leaking or they can't find the right product, you know, it can really impact their life. And I know as a clinician, it gets really, really frustrating on our ends many times. So thank you, Shield, for sponsoring us and helping us get this information out. All right, so we're going to begin with talking about terminology. When you're talking about ostomies, you're talking about stomas, so many times these terms get used interchangeably. However, they're not interchangeable terms. So before we get going in this presentation, I'm actually going to give us a tour through the GI tract, and we're going to look at several different types of ostomies. All right, we're going to look at a colostomy and an ileostomy first, and then later in the presentation, I'm going to explain what a urostomy is. Now, you're going to have the potential with the camera right there to make your camera screen bigger or to make the camera screen smaller. You may want to make it a little bit bigger for this because I am a big girl right here. And I've got the apron on because we're going to take a tour through that GI tract and first look at a colostomy and an ileostomy. So we chew our food, it goes down our esophagus and into our stomach. Once the food is in the stomach, it's held, it's churned, it's stored, and then it's slowly released to travel into the small intestine. And as it makes its way into the small intestine from the stomach, the gallbladder, the pancreas, and the liver, they're all adding additional digestive enzymes to help break that food down as it's making its travels through the small intestine. I tell my patients the small intestine eats for you because that's where so much of the digestion is happening right there, especially in the jejunum. Now, after the chewed up food has traveled through the small intestine, it's going to make its way into the large intestine, also known as the colon. Now, the job of the small intestine was to eat for us, but the job of the colon, or the large intestine, is to drink for us. And it drinks for us by absorbing the liquid out of that chewed up food as that chewed up food is making its way through the GI tract and then exiting out of our anus. So the first surgery I'm going to explain is a colostomy. That can happen anywhere in the colon or the large intestine. I'm going to show it right down here in the descending section. So you've seen me separate the GI tract right here, separating the colon. And I can leave this little section intact right here, and it's known as the Hartmann's pouch, or it could be completely removed. For this presentation, I'm going to leave it intact. Now, I've got to do something because I've got food going in here and an opening right here where stool can come out. What the surgeon would do is create a stoma. The surgeon creates a stoma on the outside of the abdomen by making an incision. You can see I've made an incision right into the front of this apron. Then taking the open end of the colon, bringing it out through the abdominal wall, folding it over, and suturing it down. This is much the way the abdomen is going to appear for that person that has a colostomy. They're going to wear a pouch over it to collect that stool. And the stool's going to be formed much like we would go to the bathroom if we didn't have an ostomy. Now the next procedure I'm going to explain is an ileostomy. With an ileostomy, you're either bypassing or you have the entire colon removed. And it is going to come off of the ileum section of the small intestine. Now it's the same stoma procedure. The surgeon makes an opening in the front of the abdomen, pulls the end of the small intestine through, creates a stoma, and this is where the output is going to leave the body. And when you think about an ileostomy, think about the output that's going to come out. This was where digestion was happening, right? Where the food was being broken down. Well, if those digestive enzymes can break down a steak and cabbage inside my small intestine, they can certainly break down the skin when they get on the skin. So whenever you have that ileostomy, if you have a leak, it is so very important to get the proper pouching system on there. All right, so I've showed you a couple of different types of ostomy procedures. And the stoma was the part of the GI tract that came out and was folded over, and that is where the stool is going to exit the body. Now, you can have an end stoma, which is what I just showed with both of those aprons. It's where the end of the bowel is brought out, folded over, and you've got one opening. Or there's something called a loop stoma. With a loop stoma, they bring a loop of bowel out. They make a split in it. It's usually secured with a rod that's left in place maybe 7 to 10 days. That split is going to allow the stool to come out. And many times your loop stomas can appear more like this or pushed together just like that. Right? So that's going over the terminology. So know that there's a difference in those words, ostomy and stoma. We have a lot of ostomy surgery that's happening here in the United States. It actually happens all over the world. And this surgery saves people's lives and actually gives them their life back. Think of that person with Crohn's disease that has 30 bowel movements a day. You give them an ileostomy and you literally give them their life back. But the problem is, especially with ileostomies, so many people experience problems. Skin irritation, pouch not fitting, not being able to find the right product. So today we're going to look at 10 common ostomy problems, and we're going to look at some solutions for them as well. We're starting out with peristomal skin irritation. Boy, this can be a problem. It can be an inflammation reaction from the soap or the solvent that they're cleaning their skin with. It could be the adhesive from the product that they're using, and it can actually be from their own output as well. Now, it can also be from pressure or shearing, like I said, a bad fitting appliance on there, or even the person wearing that ostomy belt trying to get a good fit, but having it on too tight. Another problem that we see is abrasive cleaning. That person who removes their skin barrier by gripping it and just ripping it off the skin. Or I saw on Facebook one time a girl said she had a lot of blisters up underneath her skin barrier, her wafer, when she removes it. And she said she gets in the shower and just busts all those little blisters. And then there can also be somebody who just obsessively changes their pouching system too often. So what can we do? What are some solutions? Number one, let's first check the pouching system that they're wearing. When that person comes to you and they have that pouching system on, you want to take the opportunity to have them sit down in a straight back chair and you examine them from side to side, because when you look at them from the side, their body makes different contours than if they were standing up. So make sure that they're sitting down and you're seeing how that pouch is fitting them. Then have them remove the pouching system, or you remove the pouching system, and make sure that you look at the back of the pouching system after they take it off to see if there's any leakage that has been unrecognized back there. Review, remeasure, revise that system as needed. Now, something that can also be helpful when you're removing the ostomy pouch, that would be to use some type of adhesive remover, something like you're looking at on your presentation slide, and I'm holding right here. The newer ones, like I just held up, are made of silicone, and these should be called adhesive releasers, because you can actually spray this adhesive remover on many products and it literally can fall off the skin. So your different adhesive removers that are out there, think of using them to help eliminate peristomal skin irritation. But we've got to think of this. We have got this irritated peristomal skin being the skin around the stoma. We've got to put another skin barrier on it right away. So what are we going to do? Well, if you're looking at the picture on the screen, you see the ring of fire right there around that stoma. What does the ring of fire do? It burns, burns, burns. That's what it does. So what can we do? Well, we can do the crusting procedure. What the crusting procedure is going to do is put down a layer of crust in between the skin barrier that we're going to apply to the skin and the skin. It's going to allow that skin to re-epithelialize and close up underneath that crust. And then when we go to remove that pouching system, that skin barrier, it's going to lift the crust up, but not interfere with the skin. Now, what do you need to do the crusting procedure? Well, since you've got raw skin, you want to make sure that you have some type of alcohol-free polymer skin barrier wipe or skin barrier spray, whichever one you want to use, and some stoma powder. Those are the products that you're going to need. Now, you want to make sure that the person is not allergic to any of these products. They're not allergic to the powder or the skin barriers before you use it. And know that this is not a prevention technique. This is a technique to allow that skin to heal. What you're going to do the procedure is on your skin, you're going to sprinkle some of the powder. I'll go ahead and do some crusting right here on my skin so you can see it. Now, I have sprinkled out a lot of powder right there, okay? A good bit of powder. Remember, when you're doing this procedure, you don't want powder on there like you're flouring a chicken to fry. I always use that expression because I think you understand what I'm talking about. You don't want it too thick, all right? You want a thin veil of powder. And then what you're doing is you're taking your alcohol-free skin sealant and dabbing it. And you're going to allow it to dry. Now, if you want to use a spray, that's fine. I typically teach with the little wipes, though, because if you can do it with a wipe, you can probably do it with a spray. All right, you're going to allow that to dry, and then you're going to build up another layer of crust on top of it. I saw a girl on a YouTube video that had a powder makeup brush, and she actually whisked off the extra stoma powder with that brush, and I thought that was a great idea. But I'm going back over it again with some skin sealant, creating a crust on my skin. So here's my little pseudo scab, or my crust, whatever you want to call it. And when I put the skin barrier, if I were to adhere that to it, when it's time to remove the skin barrier, it's going to lift up the crust and allow that skin to heal. Now, people do different layers of crust. I typically do 2 layers of crust, but I know people that do 3 layers or 4 layers. So whatever is going to work best for your patient. I do recommend you experimenting with this crusting procedure on yourself. You know, you can do it on your arm, your hand, just like I did. Give it a shot. This is a great way to help that skin heal. Remember, it's not a prevention technique, it's a healing technique. All right, so that was problem number 1. Problem number 2 is having that flat stoma. This is another one of those another one of these topics that we could actually do a whole webinar with. But let's talk about a flat stoma for a minute. What's a flat stoma? It's one that doesn't protrude. It's right there at the skin level, sometimes even retracted down below the skin surface. And we know that many times these give us a lot of problem because effluent, when I say effluent, I'm talking about the output out of the stoma. That effluent can undermine, drain right up underneath it, and just continue to leak and irritate this person's skin. So why might somebody have a flat or a retracted stoma? Obesity is going to be your number 1 factor putting you at risk, but also having scar tissue there, having a short stoma, or having the stoma improperly placed in the first place, or early removal of it. Now, if you're trying to wrap your head around why these would make a difference in this stoma, let's take a look. Let's go back to the apron again. And when I made that colostomy stoma a second ago, I made it nice and budded. Budded is the term that we like to use when it sticks off of the body, it buds out. Can you see how that buds out? It sticks off the body. Why do you want it to do that? You want it to do that so the stoma sticks out into the pouch and the effluent can just drain right on down. When I'm working with this apron, I'm working with cotton and fleece. So it's easy for me to make a budded stoma. But what if I had adipose tissue on my body that was preventing that stoma from being as budded as it would? And you know, think about adding 40, 50, 100 extra adipose pounds to your body, and that is going to make a difference. The GI tract is not like a water hose where the surgeon can just loosen as much as they want and bring it out and make that stoma. If that was the case, everybody would have beautifully budded stomas. But the surgeon can only separate a certain amount of the GI tract from the blood supply because they've got to keep this vital and viable. That's the word I'm looking for, viable. It's vital to keep it viable. All right, now I wasn't able to pull out as much GI tract now that I've got all this adipose tissue on. And let's look at the difference that stoma is going to make. Well, number 1, it's harder for me to fashion this in the first place, and I'm working with cotton and fleece. So imagine how harder that would be for that surgeon. Sometimes people don't know that they're born with short bowel. So if you can see closely, you can see the little divot right there into the body. You can see that there's puckers right here on this apron, and that is because of the extra amount, and I would say the realistic amount of adipose tissue that's right there. So what are the options for this person to do? The first thing I would say, use a convex pouching system. Now what's a convex pouching system? Here's a pouching system that has a flat wafer. Here's me a pouching system that has a convex barrier. So as you're seeing in my camera right here and on the slide, a convex barrier is going to reach down toward that stoma and help push or lift that stoma up, make it stick out more above the body. You want to use convexity on those stomas that are flush or flat or retracted. You can also use convexity on stomas that have soft tissue right there, even if the stoma protrudes a little bit, but has soft tissue around it to kind of firm it up and help that stool go into that pouch better. Now, there's some times that you've got to be very, very careful or that you don't want to use a convex product. When it's a new stoma, less than a week old, we've got to be very careful. We've got to treat that stoma basically like a wound. If the person has peristomal varices, a Crohn's ulcer, or a wound, pyoderma gangrenosum, sometimes called PG, we don't want to put excess pressure on any of those. Also, if the stoma has mucocutaneous separation, meaning separation right there at the mucocutaneous junction, muco meaning mucosal tissue, cutaneous meaning skin. That's right there in the picture you're seeing where the stoma and the skin are supposed to be put together, but it has just pulled away from that skin. That picture on the screen is showing you mucocutaneous separation, pretty pronounced, circumferentially, or from 12 o'clock to 12 o'clock, all the way around that stoma. So another time you got to be careful with convexity, or another thing you got to look out for, that's too much pressure. And as you can tell from this pressure, from this picture on the screen, looks like there's been excess pressure right there. So whenever you put somebody in convexity, it's imperative that you follow up with this person. You know, just put them in convexity and send them off into the wild blue yonder wishing them the best. Follow up with this person because you put them in a pressure device. Now, I'm not trying to scare you about convexity. Convexity is wonderful. Right? We've got convex one-piece pouches. We have convex two-piece pouches. And if you only have flat pouches in your facility, they actually make these nifty little rings. So here's one right here. These cool little rings that you can put on the back of a flat skin barrier, and they give you convexity. So this is an add-on piece. And notice in the picture, they also make this an oval. So that's very beneficial for that person who has that oval stoma. Other things that can help when you've got this flat or flush or retracted stoma, using a belt. These little belts are like about an inch wide. For many of the pouches, it's going to be a loop on the barrier, and then on some products, the loop is going to be on the pouch. So different manufacturers put these little belt loops in different places. Some companies have one belt loop on either side. Some companies will have two belt loops. Coloplast, their Mia has two hooks on either side. So the belts aren't necessarily universal. But what these belts can do is help hold that pouching system closer to the body and give that person a longer wear time. Now here's an example of a retracted stoma. They're using a convex skin barrier. What they're doing is they're taking paste, and paste is that pink ring that you see around there. They're going around it with paste, and then they're using a moldable barrier ring, then seating the skin barrier and pouching right on top of it. So that's a little down and dirty on what you can do for those retracted or flush stomas. And in a word, convexity. That's what you want. All right, moving on to number 3. Number 3, we are talking about mucus accumulation. You can have mucus that accumulates down here in the bottom of the pouching system that can actually cause you problems with being able to drain or empty that pouch. Now, why do you have mucus in the urostomy pouch? Well, let's take a look and see how a urostomy is done. And for this little presentation, I'm going to take these kidneys and I'm just going to plop them right on the front of this apron. I know that normally the kidneys are behind the GI tract, but for this demonstration, I'm going to just put it right out here in the front so it's easier for me to explain. All right, we've got our kidneys, our ureter, our bladder, and our urethra. Now, in real life, a female urethra would be very, very short, and a male urethra, we would like for it to be much, much longer. When we're looking at the different parts of the urostomy, the urinary system, let's think about one reason somebody might have to have their bladder removed, and that could be bladder cancer. For bladder cancer, typically we see them remove the bladder. Now, what the surgeon could do is attach one ureter to the other ureter and bring that ureter out and make a stoma. That would be a ureterostomy. The problem is those stomas from those ureters like to stenose, so they don't really make good stomas. So what surgeons actually like to do is go to the small intestine and remove a section of the small intestine. Then reconnect the GI tract. Now, the surgeon has this small little section of ileum right here. And they're going to create a conduit. You know, a conduit is something that carries something from one place to another. They're going to make this little section of ileum a conduit. by closing one end of it off, then implanting the ureters right into this little section of ileum, and then doing that same stoma procedure that I showed you earlier. Now, the medical term for most urostomies, or the urostomies that are fashioned this way, is called an ileal conduit. The name can be confusing because it kind of sounds like an ileostomy. But isn't this amazing, the way that they take part of the GI tract and turn it into the urinary system? That's amazing. But the thing about the GI tract is it's secreting mucus, a lot of mucus. Number one, to keep things sliding through. But it also secretes mucus to help protect that inside of the small intestine. If not, those digestive enzymes could just eat their way through it. So with this mucus that's right there for protection and to keep things moving along, it can slough off and get into the bottom of the urostomy pouch, as I said before, and actually clog this little tap up right here on the bottom. Nobody wants that. So there are products that are out there. Mucus First is one of them. Just a couple of drops of the Mucus First in there. It breaks up that mucus and the problem is solved. Okay? Easy fix for that one right there. All right, moving on to number 4. Number 4 is a problem. It is a ballooning pouch. And just as you're looking at the picture right there, you know, that pouch would be really hard to conceal under clothing. If that was your patient and they were laying in the bed, you know what would happen. That arm would hit that pouch, it would come right off, and you would have a mess right there in that bed. Well, what you can do about that is put a filter on there, use a vent, or get a pouch with a filter. So there's an easy fix for it. But for that person who is complaining about having a lot of gas, you know, people pass gas very often. It says on the screen anywhere from 13 to 21 times a day. Chances are somebody has passed gas during this webinar. Wasn't me, but I'm just saying, You know, when you don't have an ostomy and you pass gas, it goes right out into the environment. But when you're wearing a plastic pouch on your body and you pass gas, it goes right into that pouch. So you are well aware of how much gas you have. It can be helpful for that person who comes to you complaining of frequent gas to do a diary. Write a food diary of the foods that they're eating so they can kind of pick up on what foods are more gaseous for them, and let you see how many times they are having to empty that pouch or just burp that pouch. That's what we call it, burping that pouch to get that excess gas out of there. Some frequent causes of gas, of course, different foods. There's a lot of foods that cause gas. Different drinks can as well, sodas, beer, even mineral water. It's easy if you drink with a straw to take in a lot of extra air. And also when you chew gum, it's easy to swallow air with that as well. And of course, those little babies sucking on that pacifier and crying, they're going to have a lot of excess gas. Years ago in the early 90s, I remember we used to take a pin and poke it in the tops of the pouches to help release that gas. But we don't do that anymore. We don't do that because pouches have evolved so far, and now they have filters that are available on them, or you can put a filter on them later on. So as I'm talking about some of these filters that you could put on or that they have on, you're looking at the one on the top right there is the Osteo Easy Vent. I have one of them right here. This is a very common little vent that you would put on the pouch after you have purchased it. There's several YouTube videos showing how this attaches. It's got some adhesive on the back. It's just going to stick right on the pouch there. And then much like you would plug the port of a beach ball, it opens and closes for you to vent that pouch and allow the gas to escape. And in the last year or two, they kind of revised the Osteo Easy Vent and made it even easier to use. There's other things like the Floater by Coloplast. They have one that you can put on. But you can also purchase pouches that have these filters in them. There's a filter at the top of this pouch. Here's this pouch, which has a filter at the top and then a pre-filter that goes all the way around it. So filters, vents, that's the way to go for that person who has a lot of ballooning. Please know that with the filters, if they have charcoal in them, if they get wet, they don't function anymore. So the filters that are on the pouches that have charcoal in them come with these little stickers. And those little stickers are to go right over that filter when the person is swimming or when they're showering. Okay. All right, let's move on to number 5. And what is number 5? Difficulty getting a good seal. This is another topic that we could easily spend a whole webinar on. I tell you, whenever you can't get that good seal, of course, the first thing that you're thinking of is leakage. And if you've got a colostomy and you're thinking leakage, you're thinking odor. If you've got an ileostomy, the first thing you're usually thinking with leakage is going to be skin breakdown. But in any event, it can be embarrassing and costly to be experiencing these leakages and not being able to get this good seal. So number 1, what you want to do is make sure that you are preparing that peristomal skin properly. Get rid of all the old adhesives that are on the skin. If you've got excess body hair, trim that hair away with scissors or maybe a battery-operated trimmer. I know a couple of men that have actually gone and had laser hair removal on their abdomen, and it's worked really well for them. But clean this area, make sure that there's no hair there, and make sure that it's dried really, really well. Another thing that you want to do when you're getting ready to apply that skin barrier is make sure that it is warmed appropriately. And that doesn't matter what brand of product that you're using, you want to warm it up. And when I say warm it, you want to warm it just like this, in between your hands, not with that hair dryer. That can get it too hot, and it can actually interfere with some of the adhesive properties inside the wafer itself. So warm it to body temperature. I know women that slide it in their bra. I know men that'll stick it up underneath their leg, or a bedbound person behind their back. But in any event, bring the back of this to skin temperature before you put it on the skin. Now there's other products that you can use to help get that good seal. The first one that we're going to talk about is Stoma Paste. Paste, paste, paste. These are great products, but guess what they're not? Adhesive. I know that it says stoma adhesive, but it does not say stoma adhesive, all right? Pastes are caulk, and they're a great product. I am not knocking paste. I'm just saying it's not what you normally think of when you think of paste, because when I think of paste, I'm thinking of something adhesive. With Ostomy Paste, it is a caulking product, and you would want to use it the same way that you use caulk around your bathtub to prevent that liquid from getting in an area you don't want it to get. So on the screen, you're looking at where you want to put your paste, and that's going to be right there at that inner opening, at that inner ring right here. Because when you go to apply this to the skin, you want it to ooze up around the stoma, just like in that bottom picture. You want it to ooze right there into that opening. What you don't want is the paste on the back of the skin barrier just being spread all out. It is going to interfere with your adhesion. Please read the manufacturer's insert. Paste is not an adhesive product. It's a caulking product. Now, paste can be difficult to deal with, but it's a lot easier if you'll wet your finger and spread it around. It's going to make it a lot easier to work with. When you go to remove paste from the skin, it can make a mess. So use those adhesive removers, or definitely allow it to dry and then just kind of flick it off the skin. Don't pick it, flick it off of the skin. You can do that as well. So here's some examples of some different paste. And where I'm not much of a paste girl, I am a ring girl. We've got different rings to show you from several different companies. Now, what I like about a ring is adhesive. Put this ring in your hand, between your hands, let it come to body temperature. This does have adhesive technology in it. And by heating it up, it's going to adhere to my skin better. It's going to form in all those little nooks and crannies of my skin. I'm going to separate it. When you're putting it in between your hands, you want to leave the little plastic on each side of it. Take it out of the outer package, but leave a little piece of plastic on either side. See how flexible that it got from right there in between my hands? And what I can do with it is I can break it apart like this. I can stretch it. I can stack it. I can bend it. I can roll it up as well. Some people like to roll theirs into a snake form, all right? They like that better than the ring. And also these are available in strips as well, all right? This is the snake method. Whatever works best. When you're trying to get that perfect pouching system and not have that leak, folks, MacGyver it. It is trial and error. Whether you're talking to an expert or somebody new at it, it is trial and error because everybody's body is different. So get as many supplies as you can in your arsenal so you'll have a lot of things to work with. All right, this is showing again how they've torn that ring and they're stretching it right on around that stomach. And here's some different examples of the different rings that are out there, and all of these are available through Shield. Here's the skin barrier strip, kind of like one that I showed you a second ago. I believe Laura is a fan of the strips, and I think she likes to roll hers up and snake them together. Laura is full of great pouching tips. Okay, number 6, moving on to number 6, that's going to be swimming with an ostomy. You know what? That is one of the biggest questions I'm asked is, can I still swim with an ostomy? Absolutely, absolutely. No one should not be allowed to get in the pool just because they have a pouch. No, they still should be allowed to swim. But there are some precautions that person with an ostomy is going to want to take before they get into water. Number 1, they want to empty the pouch before they get in. Maybe eat a lighter meal than usual. If you've applied a new pouch that morning, you want to wait a couple of hours, make sure that it's adhering well, and definitely carry a change of supplies with you as you're going swimming. Now, there are products that are out there on the market that can make pouching or swimming with an ostomy a lot easier. The first ones that come to mind are these Hydrocolloid flange extenders, just like this. They're available in multiple sizes. They're also available in multiple shapes. These actually come from Coloplast, but Coloplast, although Coloplast makes oval-shaped products, they know not everybody uses an oval-shaped product. So they have strips that will fit on all the different manufacturers' products. They even have one that's got this odd Y shape. And where that is going to help is when that person has a crease right there on the side, this can really help secure that down. Something that's great about the Coloplast elastic skin barriers, that's what these are called, is the fact that they are elastic. They stretch, they give. So that person that has a hernia, that's body is changing throughout the day, or that pregnant woman whose belly can move around, you want something that's going to give, and these will give. Other products that you can use for swimming with an ostomy, the AquaSeal. The AquaSeal and the SureSeal ring, I believe they're from Costa Medical. This is written in your handout. All the products that I'm talking about today are in the downloaded handout that you've got. So make sure you download that. Donna did a great job putting that handout together, and it can be a resource for you after this presentation is over. But you should see the information on where you can find these products. AquaSeal is one that's talked about very frequently and recommended by people that have ostomies that swim on a regular basis. And then, of course, for fashion with swimming, Ostomy Secrets. That's the place you want to go to find bathing suits or underclothes or sexy garments for people that have ostomies. And Ostomy Secrets garments have these little pockets in the front that help support the weight of the pouch. They have bathing suits for men and women. And then Stealth Belt. A stealth belt is a belt that actually houses the ostomy, and people who like to do cliff diving or skiing, where there's a lot of drag that comes across the body that can certainly loosen that pouch up, a lot of them wear that stealth belt for sports activities. So go to YouTube or go to stealth belt, check out that belt as well. All right, moving on to number 7, managing effluent during the appliance change. Have you ever wanted to do crusting on somebody with a urostomy or an ileostomy, but they had so much output, you just weren't able to take care of it because leakage, 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 leakage. Well, I'm going to show you a trick that Margaret Heel, a WOC from the UK, came up with, and this is an amazing little trick. How to hold back effluent while you're trying to pouch. All right, so here's my stoma, and what I'm going to need is an index card and a little piece of tape. So what you're going to do is, with the index card, Margaret says this is a very important step. On the little line at the top, you're simply going to fold it back. You're going to take your nail and rub it down because you want a good, solid area to be able to tear it. All right, so I'm going to fold it back and forth a couple of times. This is going to help me tear it on this line, and it's going to come out nice and smooth, I hope. Yep, so far so good. Okay, so now I have this frayed edge. Margaret says that's important because it's going to help alleviate a possible paper cut, but best of all, this frayed edge is going to help wick up any moisture. Okay, now back to the stoma. I'm going to take this index card and I am going to wrap it around the stoma, just like this. I'm going to have to set it down to do it with 2 hands. All right, and then I'm going to tape it. So I've taped me a little chimney right around my stoma. See that? I've taped a little chimney right around the stoma. I can take toilet tissue or cotton balls and stuff it down in there, and that is going to absorb that effluent as it comes out and allow me to prep this peristomal skin. Now Margaret actually takes it a step further, and Margaret will actually seat her skin barrier right over that, and then she removes this piece right here. So nifty little trick right there, nifty little trick. I call it the healing technique after Margaret. Okay, and what are we looking at next? Let's move on to our next slide, and that is going to be playing contact sports. There's not a sport that you can't do with an ostomy. It is all about us finding the right guard, the right protection for that person. So what do we have? Well, let's take a look. On the top right-hand side of the screen, you have got the Stoma Shield right here. This is a Stoma Shield. You can see that it's curved. That's going to allow the pouch to be able to drain right behind it. With this, let me make a cover up the front of me, and I will show you how it would work. Here's the Stoma Shield. You could see that it would protect not just the stoma, it would also protect the pouch part of it as well. You would want to use this to help prevent from blunt force trauma, or maybe the seatbelt. Lots of uses for this product right here. It's available in a couple of different sizes and a couple of different colors. Now another one that I want to show really, really quick, that's the Stoma Dome. And that is the one that's pictured right there on the bottom left, the Stoma Dome. It's this plastic cap that comes with these 52 crescent strips. And you put the crescent strip on the pouching system, and then you wear the cap when you want to wear it, remove it when you don't want to wear it. I recently recommended this to one of my patients who had a year-old baby, that the baby would be on her hip and the baby's leg was just rubbing right across her stoma and had lacerated the stoma a couple of times. So she uses this real low-profile guard now to help protect the stoma. Now the Ostomy Armor that you're looking at down in the bottom, they have the capability to actually make 2 guards on one belt, and they have one for feeding tubes as well. So again, there's not a contact sport that that person with the ostomy can't participate in. It's just as clinicians, we've got to find them a guard that's going to help protect that stoma and protect the pouch. All right, moving on to number 9. What about that person that has a colostomy and doesn't want to wear the pouch? Well, you know what? Let's think about the colostomy. The colostomy has formed stool. There can be a lot of odor with this, and when they're emptying it, that odor just comes right up in their face. And it can be overwhelming for that person that has a colostomy. So are there any options? Well, yes, there are options. Number 1, the person with a colostomy could use that closed-ended pouch if they wanted to. But number 2, they could do colostomy irrigation. Now, what's colostomy irrigation? Colostomy irrigation is essentially like an enema. You are inserting water into the stoma of the colon, and that's going to stimulate those peristaltic waves to help empty that bowel. The goal is for feces to only pass when that stoma is filled with water, or when that bowel is filled with water. And what this is going to allow this person to do is not have to wear a regular traditional ostomy pouch during irrigation sessions. Typically, people irrigate every 24 hours. Some people even push it every 48 hours. And on occasions, there are people that push it out to that 3rd day. But it's been my experience that most people feel their best when they irrigate every day. But when you irrigate every day, you don't have to wear that regular pouch. You could wear a smaller pouch or even a stoma cap. Now, what I'm showing right here is a stoma cap from Austin Medical Products, again, available through Shield. It has a little opening right here for the stoma, and then the back of this would peel off, just like this, exposing that stoma cap. And the stoma cap would adhere to the body the same way a pouch would. I explain it to my patients like a sticker. So see, this can really free that person up that has that ostomy. All right, again, colostomy irrigation works on the principle that once the bowel is cleaned out, it's going to take 24 to 48 hours for that stool to be able to move back around there to be empty from the body. It's going to depend on what that person eats and what that person drinks and their own metabolism. For the person that wants to irrigate, it needs to be that left-sided colostomy that has formed solid feces. This person also really has to be devoted to this. It usually takes about an hour to do the irrigation procedure, and they're going to want to do it every day within the same 2-hour time period. I'm in one of the large Facebook groups that is for irrigation, and people love this procedure. I've met people in there that have been doing this for over 30 years. It's very big in Australia. They even have a pump. It's kind of like a water pick to help instill the water into the body. We don't have that over here in the United States. Over here in the United States, we use a typical irrigation bag. It's got tubing on it, a cone. A very, very important part of this device is this silicone cone. That's what's going to go inside the stoma. And the person is going to wear a long irrigation sleeve as they do this irrigation. So if you want to know more about colostomy irrigation, there's several different videos on YouTube that you can see somebody actually do the procedure. I'm big on making sure people with colostomies know that this is an option. Now, what are the contraindications for colostomy irrigation? Number 1, a urostomy and an ileostomy. You know what? We're not going to be able to make that continent, all right? And with colostomy irrigation, that's your goal. You're trying to make an incontinent ostomy continent. But you just got too much output with a urostomy and an ileostomy. Also, if you have issues with the stoma, like a prolapse, a retraction, or a hernia, with a hernia, colostomy irrigation just doesn't work well because the fluid gets trapped inside those loops of bowel that are in the wrong part of the body, and then it leaks out later on, and that's not the desire for that person. Years ago, colostomy irrigation used to be bigger in the United States, but over the years, it's just kind of fallen along the wayside. So as a clinician, please make sure the patients with a colostomy know that this might be an option for them. And hey, we want to give people options, right? Okay, moving on to number 10. Number 10 is a biggie. Where can I find a reputable resource for patient education? First place I want to direct you to is one of my ostomy heroes, and that's Laura Cox, right here with Shield. Shield is a wonderful resource as well as a great place to get these supplies that I've talked about today. But Laura is just a wonderful resource herself, full of information about living with an ostomy and covering those problems. Another place that I direct my patients to is the United Ostomy Associations of America, the UOAA. That's UOAA.org. You know, another thing that you might want to consider doing is becoming certified yourself. You be that resource for your facility. You know what? Have you been thinking of doing something different? Maybe you're kind of bogged down in your position at work and you're thinking, I want to do something else, and you're looking for a sign. I want to do something different. Here's your sign, folks. Get ostomy certified. Here in the United States, you can get ostomy certified through the WCEI or through the WOCN. I happen to be certified through both of them, so I recommend both of these programs. But you know what? Sometimes one program is going to fit better in your lifestyle. So check out both of the pathways to becoming ostomy certified. Check out both the pathways through WCEI, WOCN. Find the one that works best for your lifestyle, and please get on that pathway because we need more certified clinicians here in the United States. Life is blooming. Life blooms with good care, just like it says right there. Well, I'm getting ready to turn it back over to Laura. I'm going to look and see if there's any questions right here that I can answer. Let me see if I've got any questions showing. I don't see any questions. If anybody's got any questions, you can post them on up there. Laura, are you available?
Yes, I am.
Laura,
hi there, Joy.
Can I say thank you again, Shield? Thank you, Laura, as usual, but thank you again, Shield, for allowing us to bring this information. Love doing this. Love spreading the gospel of the bowel.
Well, absolutely. Thank you so much, Joy. That was so helpful and so informational. I appreciate it. So please type your questions into the question box to the right-hand side. And while you're typing in those questions for Joy to answer, I just want to do a quick plug. So Shield Healthcare has more than 1,400 ostomy items to meet your needs. We have exceptional customer service. We took a survey and 99% customer satisfaction, and we are serving Medicare ostomy customers nationwide. And if your patients would like to contact us, you can call our Medicare specialized line at 1-800-675-7342. And you can also visit our website at shieldhealthcare.com/MedicareOstomy. And then I would also just like to do a plug quickly for our Ostomy Life community. This is full of lifestyle information from ostomists, from ostomate to ostomate, and it's all about lifestyle concerns and making life beautiful and wonderful and full with life with an ostomy. So if there are any questions, please type it in the right-hand side. And just a reminder that you should be able to get your CEs within 24 hours. You'll receive an email from WCEI. And also, lastly, this whole webinar will be recorded and up on Shield Healthcare's website. So if you missed something or would like to refer back to it, it will be available up there.
Laura, I see a couple of questions. Can I answer them?
Absolutely. Please do.
All right. The first one's from Emma, and she's asking, what is that pink paste? All right. The pink paste, I was told that that is one of the pastes that they have over in the UK. We don't have it here. All of our pastes are kind of a tan color, but it's a paste that's available in the UK. Now, if you're wondering if that was a denture adhesive paste, I don't think that one was. I think that was the paste from the UK. Next question is, what if the stoma lumen is facing downward? Oh my goodness, I'm with you on this one right here. We see these stoma lumens facing downward, especially when it's this loop stoma. And you've got this opening right down here at the bottom of the peristomal skin. On that one, I definitely would recommend that you use Convexity. You want to prep that skin by using maybe a protective barrier spray. You could also, along with Convexity, use these moldable rings. You can even add more Convexity by bending them in half and making it thicker. These rings are available in different thicknesses, somewhere around a 2 millimeter and a 4 millimeter thickness. So only put the Convexity where you need it. That might help you kind of torque that opening, you know, down a little bit. So very, very good question right there. Next question. How would I use the strips or moldable ring on the uneven surfaces? Those strips and those rings are there to help you create that flatter peristomal skin plane. That's what your goal is. That's what you're wanting to do, is create this flat plane right here. So the moldable rings or the moldable strips, anywhere you needed it to be flat, put it in there. And then finish it off with one of these rings just flattened over the top of it. All right, next question. Where can I get more information of colostomy irrigation? I would say the United Ostomy Associations. That would be one of the places that's just right off the top of my head that I can direct you to that has more information on it. Do you have to be a nurse to be a certified ostomy person? No, you do not have to be a nurse to be a certified in ostomy care. You can be a physical therapist, an occupational therapist, or a surgeon, and WCEI will certify you through the Ostomy Management Specialist program. As for nurses, you can be anywhere from an LPN to a doctorate in nursing for the WCEI. For the WOCN, bachelor's degree, master's degree, and doctorate degree nurses. But get certified. I certainly hope some people are considering getting certified out there. All right, any other questions? Let's see. How do you differentiate between infected peristomal skin and a simple irritation? I would say that other factors are going to come into play here. You're going to want that experienced wound clinician to kind of take a look at this. And many times that wound clinician's put in the position to be an ostomy clinician as well. But actually, we don't see as many infections around the peristomal skin as one might think. We by far see more irritation right there in that area. All right, Laura, we are getting down to the wire on time. I'm going to turn it back over to you. Those were some great questions.
All right, thank you so much, Joy. And I just again would like to thank all of your participants. I would like to thank WCEI, and Joy is saying get ostomy certified. So look for that email in your inbox. And thank you so much for coming to our webinar today. Thank you so much, Joy.
Thank you. Thank you very much.